بسم الله الرحمن الرحيم. مرة أخرى أبنائي طلاب وطالبات جامعة جوبا، معكم محمد دكتور Omer Nemery. Today we are going to discuss malaria. Malaria is very common and endemic disease in Sudan, and any question in malaria will be crucial and fatal if you didn't answer it. Malaria can be caused by Plasmodium falciparum malaria, Plasmodium vivax, Plasmodium ovale, Plasmodium milleri, and Plasmodium nauli, and is transmitted by the female Anopheles mosquito. And usually, malaria affect about annually it affects about 240 million patients all over the world, mainly in Africa. 88% of this number in Africa. The life cycle: the female Anopheles mosquito become infected when it feeds on human blood-contained gametocytes. The sexual form develop on the mosquito. Within 7 to 20 days, sporozoites are inoculated in the mosquito's salivary gland, and then incubated steam and then disappear in the liver. After some days, merozoites invade the blood cells, and this is the asexual cycle to produce seasons. Rupture of seasons release more merozoites. This is the life cycle. You can see this in details in Davidson textbooks of medicine. Plasmodium ovale vivax persists on the liver and cause relapse years after treatment. Pathology: red cell infected with will cause hemolysis, which is severe in Plasmodium falciparum, which invade all RBCs, especially the young one. Anemia may be profound with this erythropoiesis, splenomegaly, and folate deficiency. In Plasmodium falciparum, red blood cell containing trophozoites adhere to the vascular endothelium and vessels, congestion and organ damage, and liberating toxins and antigenic substances. And this will be very obvious in the brain, and this may cause cerebral malaria. Plasmodium falciparum has protective mutation such as sickle cell, hemoglobin S, thalassemia, and glucose 6-phosphate deficiency. And Plasmodium vivax cannot affect red blood cell with puffy blood group, and this will cause protection in Western African and African Americans. The clinical presentation usually of Plasmodium falciparum is most dangerous one, and insidious onset: fever, malaise, headache, vomiting, cough, and diarrhea, and later on jaundice due to hemolysis and hepatic insufficiency. Hepatomegaly and splenomegaly is common, while the spleen is usually tender. Anemia and thrombocytopenia is common, and serious complications develop with delirium, seizure, coma, and mortality rate is usually high in children. This is a clinical. You can see this paragraph in Davidson textbook of medicine. The parasite may adhere to the placenta chondroitin, and this may cause abortion and intrauterine fetal growth retardation. Plasmodium vivax and Plasmodium ovale, usually the onset is insidious, and Rikers called temperature may reach to 40 degrees centigrade, followed by perspiration, coldness, and flush. And the cycle is repeated every 2 days and relapse even after 2 years of treatment. Plasmodium miliary and viva and nalui usually can cause glomerulonephritis and nephrotic syndrome, especially in children. Acute severe malaria is the most serious complication of malaria, and usually will cause impaired level of consciousness, where the Glasgow Coma Scale will be less than 11, and multiple convulsion more than two, and jaundice, and pulmonary edema, respiratory distress and acidosis, and abnormal bleeding, shock, acute malaria, hemoglobinuria and myoglobinuria, severe prostration and severe weakness, and continuous vomiting. For any of these is a feature of acute severe malaria. Again, severe anemia, hemoglobin less than 7, and metabolic acidosis, where the plasma bicarbonate less than 15 millimole, and hypoglycemia, glucose level less than 40 milligram per deciliter, and hyperparasitemia, hyperlactinemia, where the lactic acid more than 5 millimole, and hyperparasitemia less than 10%, and renal impairment, where urea more than 20 millimole and creatinine more than 265 micromole. Investigation, usually thin and thick blood film, sustained by Gibbs stain, and examined by light microscopy. And presence of malaria parasite, stage, species, and parasite count per mil. And rapid immunochromatography اللي هو rapid أو بيسموها called ICT أو RDS. This is a rapid test. This will detect if it is positive or negative, but it cannot differentiate is it a recent infection or an old infection. Detect the presence of malaria, but do not the species, what the species of the malaria, and the parasite count. Can show the species and the stage, but cannot show the species and the stage. Also, you can do the LDH and ELISA. This is the Plasmodium vivax on the this is the ring stage. First slide, the ring stage, and the second stage is trophozoite inside the RBCs. This is the Plasmodium falciparum. Treatment. The first treatment of uncomplicated malaria is the combination of artemisinin plus lumefantrine. Artemisinin lumefantrine اللي هي AL in the form of tablets. It is AL or artemisinin lumefantrine is available in dispensable standard tablets, 20 milligram artemisinin plus 120 lumefantrine. You have to say 20 over 120, or 80 milligram artemisinin plus 480 milligram lumefantrine. You have to say 80 over 480. Given twice a day for 3 days. Given in hour 0, then after 8 hours, then after 24 hours, then every 12 hours. should be هتديها في أول مرة بعد then after 8 hours بعد then after 24 hours and then twice a day. It should not be taken with fatty meal, well tolerated, and can cause hypersensitivity. Treatment failure if the fever persists or the vomiting persists or parasitemia, not by rapid test but by boxing. Second line treatment is dihydroartemisinin plus piperacin and 20 milligram, and this is the form of 20 milligram dihydroartemisinin and 160 piperacin, or 40 plus 320. The smallest dose is that for pediatric, and 40 plus 320 for adult. Usually given once a day for 3 days, well tolerated, can cause some GIT upset, avoid with fatty meal, and can cause hypersensitivity. Treatment of uncomplicated malaria. This is with artemisinin lumefantrine. Treatment of Vivax, uncomplicated Vivax malaria, by artemisinin lumefantrine plus primequine. And primequine is usually given for hepatic hypozoites. Primequine usually is given in the form of in a dose of 15 milligram per day for 14 days. Primequine can cause hemolysis in patients with 6-phosphate dehydrogenase deficiency, and this is a common site of best of 5 question. In glucose 6-phosphate dehydrogenase deficiency, the dose of primequine should be reduced to 0.75 milligram per kilogram body weight with close supervision. Treatment of Plasmodium ovale and Malaria, this by artemisinin lumefantrine plus primequine for hepatic hypozoites. Treatment of severe malaria by intravenous artesunate treatment is the treatment of choice, and the dose is 2.4 milligram per kilogram body weight intramuscular on anterior aspect of the thigh, and the side effects you can cause hypersensitivity, arthralgia, cough, and skin rash. The treatment with quinine IV 10 milligram per kilogram body weight by slow intravenous infusion in 5% dextrose also is effective, and this should be continued for 7 days. The side effect can cause hypotension, hypoglycemia, and كونديس مليازيس تيتانوس أقول لك والله الكنين طرشني. Okay, thank you.